Good evening, and this is AM News. Good evening, and welcome to AM News. On today, we will be discussing the urinary system. The urinary system is also known as the renal system or the urinary tract. What is the urinary system? The urinary system is the body system which is used to remove the waste products of metabolism and extra fluid from the body by excreting them in urine. As you can see here, this is the human urinary system. Number 2 is the kidney. Number 3 is a renal pelvis. Number 4 is a ureter. Number 5 is a urinary bladder. Number 6 is a urethra. Number 7 is the adrenal gland. Number 8 is the renal artery and vein. Number 9 is the inferior vena cava. Number 10 is the abdominal aorta. 11 is a common iliac artery and vein. What is transparent is number 12, which is showing the liver. Number 13 is showing the large intestine, and number 14 is showing the pelvis. There is a lot of different physicians that are included in with the urinary system. The kidneys work around the clock, and a person does not control what they do. But with the bladder, nerves are what tells you when it's time to urinate or empty your bladder. As the bladder first fills with urine, you may notice a feeling that you need to urinate. Well, that sensation to urinate becomes stronger as the bladder continues to fill and reaches its limit. At that point, it's when the nerves of the bladder send a message to the brain that the bladder is full and your urge to empty your bladder will intensify. When you urinate, the brain signals the bladder muscles to tighten, squeezing urine out of the bladder. At the same time, the brain signals the sphincter muscles to relax. As these muscles relax, the urine exits the bladder through the urethra. When all the signals occur in the correct order, normal urination occurs. Now, in the urinary system, when it's healthy, the bladder can hold up to 16 ounces, which is actually 2 whole cups of urine comfortably for about 2 to 5 hours. The main physician is called a urologist. A urologist is a physician who specializes in diagnosis and treatment of disorders of the female and male urinary system. Another physician that is included in with the urinary system is the pediatric urologist. Pediatric urologists are the physicians who specializes in diagnosing and treating urinary problems in children. And the next physician is called the nephrologist. The nephrologist is a physician that specializes in the care of patients with diseases and conditions that affect the kidneys. The top 10 medical vocabulary words in the urinary system. So for the first word, it's going to be the renal arteries. They carry the largest portion of blood flow to the kidneys. Next, we have the kidneys. 2 bean-shaped organs about the size of fists that prevent buildup of waste and extra fluid in the body, keep levels of electrolytes such as potassium and phosphorus stable, make hormones that help regulate blood pressure, make red blood cells, and keep bones strong. And we have the bladder, which is a hollow muscular organ shaped like a balloon. We have the sphincters, which is a muscle that closes tightly around the opening of the bladder. The urethra. It is a tube that connects the urinary bladder to the urinary meatus for the removal of the urine from the body. And we also have nephrons. The structural and functional unit of the kidney. Each adult kidney contains around 1 million nephrons. It utilizes 4 processes to alter the blood plasma which flows into it: filtration, reabsorption, secretion, and excretion. We have urine, which is formed in the kidneys through a filtration of blood. Examples of substances secreted are hydrogen, ammonium, potassium, and uric acid. We have urea, which is produced when foods containing proteins such as meat, poultry, and certain vegetables are broken down in the body. Urea is created in the bloodstream to the kidneys. And we have renal veins. They are the veins that drain the kidney. They connect the kidney to the inferior vena cava. They carry the blood filtered by the kidney. Now for the next segment, what causes problems in the urinary system? Problems in the urinary system can be caused by a few things, including aging, illness, or injury. As you get older, changes in the kidney's structure causes them to lose some of their ability to remove wastes from the blood. Also, the muscles in your ureters, bladder, and urethra tend to lose some of their strength. You may have more urinary infections because of the bladder muscles that are not tightening enough to empty your bladder completely. A decrease in strength of muscles due of the sphincters and the pelvis can also cause inconsistence, the unwanted leakage of urine. Now, some common diagnostic procedures that are done within the urinary system is paleography, which is the radiographic study of the kidney, ureter, and usually the bladder after injection of a contrast agent. Urinalysis, which is the physical, chemical, and microscopic, which is the insertion of a catheter into a body cavity or organ to instill a substance or remove fluid from, most commonly through the urethra. Lithotripsy, which is a method of removing stones by crushing them into smaller pieces so they can be expelled through the urine. Nephrolithomy, which is a surgical procedure that involves a small incision in the skin and insertion of an endoscope into the kidneys to remove a renal calculus. A few commonly used abbreviations in the urinary system is ESRD, which is the end-stage renal disease, KUB, which is kidney, utero, and bladder, IVP, which is pH, which is the degree that they use, which is the symbol for degree of acidity or alkalinity. And this is the end. Hopefully you guys actually learned something today. It has been quite a lesson. Recording is not easy, and editing isn't either. Have a great day. Thanks for watching.